These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
Hi, and thanks for watching. I'm Michael Alden.
And I'm Forbes Riley. Now, today we're going to be discussing a breakthrough in health and nutrition that affects nearly 200 million people worldwide. Michael, this affects 1 in 2 women and 1 in 3 men over 60.
You know, it's actually something that most people don't think about until it's too late. And folks, that's bone health.
Because here's the deal. If you want to maintain a vibrant, healthy lifestyle and protect your bone health, well, you're not going to want to miss our show.
You know, our guest today is actually, he's been voted one of the best doctors in America. He's a Harvard-educated physician, a former faculty member of UCLA Medical School, a renowned author, a lecturer, and he's also a highly recognized authority on natural nutritional supplements.
And he's here today with us. See, he believes what he's got is life-changing. This is new information about the world of bone health. We've got a very interesting program, so please let's welcome Dr. Larry May.
Dr. May, thanks for being our guest.
I'm delighted to be here.
For those of our viewers who don't know who you are, you're obviously a Harvard guy. You've actually been on TV for years. Tell us a little bit about your background and how you actually got involved in the world of natural supplements.
Well, I'm Brooklyn-born, Harvard-educated, regular physician, started off as an academic, went into practice, but I was always interested in preventing or postponing disease.
Sure.
And sort of mid-career, I became very interested in nutrition. I worked as the chairman of the medical advisory board for a major international company. I've formulated literally dozens of products.
Sure.
And I practice conventional medicine, but I integrate nutrition and lifestyle into how I manage the person.
See, that is not typical about doctors, and that's why I'm so
that.
excited that he's here, because most doctors, you'll leave, they'll give you a prescription for something to cure something else. But doesn't it all start with what you put in your body?
Exactly. Hippocrates said that food is the best medicine.
Let the food be thy medicine, right? Is that,
correct.
Is that it?
But what you said a quote.
Is that amazing? I know that.
No, but you said something interesting about what doctors train for in school.
Yeah, we were talking about this earlier. Is most doctors don't really get a real solid education about nutrition.
That's correct.
Actually, right?
Even when we are educated about nutrition, it's the science. It's
Right.
the biochemistry. It's the physiology. It's not the practical information about what vitamin A.
That really scares me.
I mean, well, they say go take some vitamins.
Right.
Well, but we all know there's not enough nutrition in the food that we eat, given the soil that we're growing and the amount of people we need to feed. We don't eat enough vitamins and nutrients. Even if we ate, you know, nobody does it. Nobody can eat tons of broccoli and tons of really big vegetables.
Right.
So most of us are lacking. And what's the problem when we don't get enough nutrition?
Well, it depends which element. When it's calcium and vitamin D, it's thinning of the bones, weakening of the muscles, a greater tendency to fall, and if you fall, a greater tendency to break that bone.
That scares me so much. You hear so many people,
Right.
older people who fall, break a hip,
Right.
and their life is over.
And then it's too late, right? I mean, once that happens, you had mentioned earlier, it's not only life-changing, but sometimes it's life.
twofold. When an elderly person, and they tend to be disproportionately female, breaks their hip, their mortality, that is their risk of not being around in 6 months, is 20%.
Just from a broken hip?
Because of the complications. When you break a hip, your lifestyle, your activities of daily living are devastated.
What happened to my grandmother?
Really?
But
Oh, yeah.
you're in bed, you get phlebitis, you get pneumonia, you become depressed.
You don't want to move. That's what happened to her, and she just died because of that. So, all right. So now I'm getting a little nervous here because I'm young. You know, I'm young enough. I have kids. What can I do so that's not my future?
Well, there are so many things that you need to do, and you do them all.
Oh,
And even doing them all, you still could be deficient in vitamin D.
Well,
you still could have thin bones.
I just went to my doctor. One of the reasons I'm so excited to meet Dr. Larry May is my doctor announced, Forbes, you're before you get actually.
Osteopenia.
Okay, which means my bones are thinning.
Correct.
And I'm down the road that I need to do something right now.
Which again, I think we need to really highlight is you're in probably the top 1% of women in the world as far as health and fitness, and she has a deficiency in calcium, right?
But she's also a thin white woman who doesn't want her skin to age, so she avoids the sun.
At all costs. So
Right.
wait, that's not good?
Well, it is.
I have less wrinkles, but what?
One of the reasons that we do this is that nothing is black and white, nothing is yes and no. The sun is the source of energy and the transformation of vitamin D to its active form.
Sure.
It is also the source of skin cancer
Right.
and wrinkles.
Right.
So by staying out of the sun, what happens now? We don't get enough of vitamin D,
The
right?
vitamin D deficiency is frightening and surprising even to me. It's only recently that mainstream physicians have the technology to measure vitamin D.
Okay, so, all right, I'm an expert. Get this. I have no idea, sitting here right now, what my level of vitamin D is. I was supposed to have that checked?
Yes.
Well, and if they're
Scary.
low, what's the consequence?
Well, the consequence is even if you had an adequate intake of calcium, that calcium would not be absorbed and it would not be utilized, and you'd have a myriad of other problems. Your muscles would not be as functional. You'd have aches and pains. Vitamin D is a critical hormone. It's not a vitamin. It is critical to the health of almost every cell.
Okay, so what you're telling me is if my vitamin D level is low, chances are it does, I spend a lot of time inside, and I'm taking the calcium that I got from the store, I'm not getting what I need?
That's correct.
So if someone takes calcium and they are deficient in vitamin D, or they don't take it at the same time, it's essentially useless, or it's not bioavailable. Is that the?
It is not absorbed.
Sounds good.
Okay.
It is not absorbed, and it is also not functionally effective. You
Okay.
need D in order to absorb calcium, and you need D and many other microminerals in order to replenish what the bone needs.
Okay, so it gets to be basically you take all these pills that you don't really know what's the combination because your doctor didn't help you. So now one of the things you said is very important, calcium and vitamin D together. Something that you talk about, which again, I can't believe I didn't know and this is what I do. The quality of the calcium that most of us takes is made out of what?
The majority of commodity or even branded calcium supplements are just ground up rock. Limestone.
Do you guys at home just hear that?
Yeah.
I mean, ground up rock, because there's calcium in rock, so you can say there's calcium there.
Sure.
But you can't absorb rock, can you?
That's correct. It's inorganic calcium.
Okay, so you actually developed a product. It's called AquaCal. Tell us a little bit about, what makes this calcium different and why should people take it?
Because this calcium is plant-based and it is essentially a food. It's a green food.
Okay.
It's derived from
The ocean, right?
source of life in the ocean.
Okay.
Algae,
Yeah.
seaweed,
Right.
green food that brings all of the essential minerals into it as it's growing, and we harvest it at the point in time that the plant has ossified. That means turned to bone and has a high concentration of calcium.
Does that make so much sense?
Dr. May, hold on that thought for a second. In a minute, I want to talk to you more specifically again about osteoporosis, because we kind of touched upon that earlier, but I want to talk a little bit more about that in just a moment.
Dr. May, this is such valuable information. I'll tell you what, if you're watching and you're concerned about your bone loss, if you want to improve your joint health, your mobility, and just take control of your health, here's what I'm going to ask you to do right now. Pick up the phone. See, AquaCal, it's an all-natural breakthrough for those of us, including myself, you out there who are concerned with bone loss, and you really should get in touch with this. Your bone health and even osteoporosis is such a rampant problem. Now, here's the thing. This is only available exclusively through this television offer.
Best of all, we've actually worked out a special arrangement with our guest, Dr. Larry May, where you'll receive a substantial savings off the regular price of the product. Plus, if you do call within the next 2 minutes, ask how you can get your first month's supply absolutely free.
I mean, that's the deal. AquaCal has been scientifically formulated to be one of the best sources of minerals and vitamins. And what I love about our show, it is unconditionally guaranteed to work. So here's all you need to do right now. You need to pick up your phone, give us a call, and get your bottle of AquaCal right now.
Osteoporosis. We talked about it earlier a little bit. What is it? How do you know you have it? And why is it such a big problem?
Well, osteoporosis is the extreme. Everything in our body is a continuum. There's optimal health, there's deficiency, and then there is disease.
Okay.
Osteoporosis is when the bones get so low that your bone density, the number is -2.5, and it's a reflection of how you eat, how you live, picking the wrong parents,
Sure.
bad genes.
Okay, it's interesting. So is there an age that osteoporosis hits? Is like, should I wake up at some age and go, wait a second, I need to take calcium?
The recommendation to find out if you have osteoporosis is to start at 65 by getting a baseline bone density.
To start at 65?
But that recommendation isn't what you did, and most of us physicians will get a baseline when women approach or go through the menopause to see where they're starting.
I'm sorry, you can just stop right there in terms of age and what that recommendation is, because my recommendation as a health and fitness expert, I'm only in my 50s, and I've already had a lot of these things tested. I think you need to start very early. I look the way I do because I didn't wait till I had wrinkles to start doing something. I didn't wait till I got sick to start curing it. I believe that if you eat and exercise moderately, but the reason I'm here today is to really figure out how do I supplement what I'm doing, because I firmly believe that we can't get enough nutrition, you can't get enough calcium, you can't eat enough kale or milk or whatever calcium's in from the food we get today, so we need to supplement it. And that's what I think your product really does, because it's not from rock, you care to put the right nutrients together. I mean, this is a very powerful product, and I also love, Mike, that it comes from the sea.
Right.
You know, when you go back to the source of life, that is one of the things I think we need to have in our bodies.
How did you find that? How do you, when you're looking for calcium, I don't think most people look to the ocean for calcium.
Well, we look to the ocean for life. It's one of the problems with the pollution of our oceans, and that's another complicated story. And we also talked about all the complicated medical issues, but let's just deal with a young woman like yourself.
Okay.
All of us develop our peak bone mass at around 30.
Okay.
And from 30 on, it starts to decrease gradually.
How do you know if you have bone loss or you're low in all of these things?
You don't unless you have a bone density test. But one of the things that I say about vitamins, and it's really critical that they be well formulated, scientifically based, well thought out, but they are essentially nutritional insurance.
Sure.
And your premiums are lower when you're younger, right? If you're a 30-year-old, you can get $1 million of life insurance for a quarter a day. If you're 70, they won't sell it to you.
Right.
So if you're 30 and your bones are good, you can help keep them that way with exercise and taking one AquaCal.
So you can slow it down is really kind of what we're talking about.
Well, basically you support the structure and function of your bones. Bones are living things. They need to have the factors of production because they're constantly remodeling.
Right.
So
that's why we can heal a broken bone.
And that's why our skin sheds and turns over. All of our cells turn over. And the key element of nutritional insurance is to provide the factors that allow the body to optimally replace itself. We replace ourselves periodically. And if we are deficient, we replace ourselves with defective tissue, defective
Isn't
bone.
this different from any other doctor conversation you've ever had?
Yeah, most doctors don't understand nutrition and supplements. In fact, my doctor, you were talking, I've asked what vitamin should I take? My doctor doesn't say anything. He just says, just eat healthy. And, that's all he says.
I started in
That's not
this
enough.
believing that there is a best-in-class supplement, best vitamin, best fish oil, best calcium product, and I thought that the best source of that would be your physician.
Sure.
Because that person knows you. The clerk at GNC or
any
whatever place,
Right.
he doesn't know you, and he only knows what they told him to tell you.
Right.
Well, no, seriously, if you've done that, you go to even a health food store, they'll say, well, what are you looking for? You go, like calcium. They'll go, well, this is, and it's probably what the salesperson told them to say about each of the products. And one of the problems is they're in a bottle. You just read the label, you have no idea what's really in it. What I get from you is you're somebody who's researched this, you set out to develop, your mission is not just to be a doctor, it is to get people healthy. And that is what this is reflective of. Now, the plant base that you've got in here, it's, again, we were just touched on it. It's not a typical plant. It's not something that grows around. It's in the ocean, but not even in the ocean in this part of the world. Where did you find this?
The best sources of this calcium are off the coast of Iceland and Ireland, where there is a large supply of red algae.
I heard they call that the clean green coast.
Wait,
So I heard that once.
I like that.
Yeah.
Well, because they're also not very big industrial countries, so I
Right.
don't imagine they're pouring stuff into the ocean the way we are.
Particularly Iceland.
Right, 'cause
They
you-
have no people.
Right. Because you hear about how the ocean's polluted, but from where you get it, there is no industry, and there aren't huge ships going in and out, and oil and things of this nature, right? I mean,
It is pure, and
Right.
then it is purified
Right.
as well.
okay.
So it is optimally healthy, and it is a food. And as a food, it's not just calcium. It's calcium and 70 other microminerals.
What do you mean? I don't understand that.
Rock, chalk, that's calcium, plain and simple. Food has magnesium and boron and strontium and zinc and copper and a myriad of other very small amounts of other microminerals that are part of living things. Our body is full of all these microminerals.
So they call trace minerals?
Trace minerals.
Okay, all right. And that's in the AquaCal?
It's in the natural source
Okay.
that we have harvested, dried, purified, and put into a tablet.
So if you take a regular calcium, like we talked about at the store, it doesn't have these trace minerals that are beneficial for our health?
The calcium source is just ground up rock, and nobody sits down to a dinner of limestone and marble.
Is this just revolutionary conceptually? Because we've only been doing what we did. This is a very new idea about sourcing calcium, isn't it?
It is quite new.
The interesting thing about that is I think a lot of people know they're supposed to take calcium.
Right.
You hear that, but I don't think most people do, right? You know, people know they're supposed to, go for a walk and exercise, but people don't. But the people who actually are taking calcium are taking the wrong kind, right?
That
lot of people
is
are.
That's frightening to me.
absolutely correct.
Yeah.
And that's why some of the studies done on calcium replacement have been less than salutary.
Well, and then step two. So now if we were taking the wrong calcium, the second thing is if you're just taking calcium with no vitamin D, you're not even absorbing what you were taking. Is that correct?
That's correct. But most products do have some vitamin D, generally not enough. And if you're taking rock, you are going to have some of the side effects.
That's why it feels icky when that's why people stop taking calcium. You get it kind of in your belly, you don't feel good.
Yeah,
That's
like a
right. It
bloated
causes
feeling.
upward distress and it causes constipation because rock, particularly when you give excessive amounts of it, turns back into rock.
Right.
And your product, when you take it, how do you feel?
You feel fine. And people who did not tolerate other forms of calcium, either because of the rock, the lack of cofactors that are critical, had side effects that made them stop taking it. And many of my patients who were not tolerating one of the many major brands are tolerating a food-based, plant-based, algae-derived calcium.
Dr. May, I think our viewers, again, do want to tune in, but in a second, I want to talk to you a little bit more specifically about how the AquaCal was formulated, because we talked about this earlier. If you don't take the right amounts of calcium and vitamin D together, it's almost useless. So let's think about that, and we'll be right back. Folks, if you've been watching and you're concerned with bone loss, if you want to improve your joint health and mobility and take control of your health, then pick up the phone and give us a call. Again, AquaCal is an all-natural breakthrough for those who are concerned about bone loss, bone health, again, and even osteoporosis. It's exclusively available through this television offer as well.
Well, and Mike, best of all, what we've done here is we worked out a special arrangement with our guest, Dr. Larry May, where you can receive a substantial savings off the regular price of AquaCal. Now here's the deal. If you call in the next 2 minutes, and this is about urgency, you're going to get your first month's supply of AquaCal absolutely free.
That's great that you're actually able to do that as well. Folks, again, this product has been scientifically formulated. Again, it's unconditionally guaranteed to work. And the other interesting thing is it's all natural, and it's one of the best forms of vitamins and minerals that you can actually get. So again, pick up the phone and give us a call. Let's talk again about the the synergistic formula that you put together. Tell us a little bit about how it was put together.
That is key.
Okay.
Because calcium is necessary, but not sufficient.
Okay.
This calcium is much more sufficient than any other because it does have these trace minerals. But we've also added magnesium, which should be taken in a ratio with calcium to optimally affect bone structure
But why
and function.
magnesium?
Well, magnesium is another divalent, two positives that works with calcium. The two most abundant minerals in your bone, calcium #1, greater than 90%, magnesium is #2.
Okay.
Also, we include some potassium.
But if you're putting potassium in there also, does this work on your muscles and cramping?
Yes. And it may also work on your blood pressure, and we also include boron, which is another important cofactor, and of course, a large serving of vitamin D.
Well,
So,
doesn't this make so much sense? You've got a doctor,
Sure.
a formulator, Harvard educated, who has put a formula together that actually does something as opposed to just going, I want a calcium, I want a vitamin D, I want a multi. I have no idea what I'm doing at
Well, he's also
health
done
food
the
store.
research.
the key thing is the formulation looks at what were the adverse consequences of calcium and what are the cofactors that will maximize the, and we'll use the word bioavailability,
Okay.
because that implies both the absorption and the utilization.
Okay.
So it is calcium with the necessary cofactors, magnesium, potassium.
Here's the thing, let me tell you something, because I spend a lot of time researching food. I don't care how much food, and most of us don't eat enough anyway.
Right.
If you're eating fast food, or you're a woman who's on the go, doesn't get breakfast, has, you know, whatever time for dinner, I know I've popped in the occasional frozen food. Let me tell you something, there is not enough calcium and nutrition in the food we eat. Is that true?
That's absolutely true. We know, we do health surveys. People are supposed to have 1,200 milligrams of calcium a day, ideally.
We're talking bowls of kale and broccoli. You're
Right.
not doing that.
So we need to supplement.
Right, but you definitely
But we need the supplement.
need to supplement with something that works. So if somebody's out there thinking about this right now, going, do I need this? The answer is yes. If you eat any fast food, if you drink any coffee, if you have any stress in your life, if you have any high blood pressure or pain, or I mean, there's so many reasons.
Or
to
if
say,
you're
hey,
female and 50.
there you go. Okay.
Here's the interesting thing, though, is you know, is this something that someone does take every day, and if they do start to take it, are they going to notice anything? Because do they notice any difference?
#1, most vitamins, and this best-in-class calcium supplement is not experiential. However, if you have
What do you
muscle
mean by
cramps,
that? What does that mean?
that means that you
don't feel anything?
take it and feel something.
Okay. All right.
Okay? But if you have muscle cramps, it's my first move. If a patient comes in and says, I got up at night and my calves were just killing me, the first thing I do, no matter male, female, young, old,
It's a common problem.
muscle cramps are a very common problem.
Okay.
But by giving a lot of vitamin D, many people do experience a reduction in aches and pains.
Okay.
And
Wow,
that's well
that's huge.
proven. In fact, vitamin D sufficiency, when you have enough, has been associated with a really significant, a statistically significant reduction in fall risk.
Really?
Because it benefits your muscles as well as your bones.
So here's my take on this. It's a little bit like an insurance policy. You don't always know if you need it, when you're going to need it. You may never use it. But I can pretty much guarantee if you don't take a qualified calcium mixed with vitamin D to make it work, something along the line, you will end up with some sort of bone deficiency, yes?
Yes, and the point that I think Mike was getting at, you do need to take it every day because calcium is so critical to so many biologic functions, our heart rhythm, our muscle function, that our body is designed to protect the serum calcium level.
You take it every day. You just, you almost feel better knowing that you're taking it, right?
You're putting yourself back in balance.
Right.
The yin and yang, you break it down, you build it up. You don't want the body to experience a sense, oh, there's not enough, so I have to take it from somewhere.
Are there things that people do every day that actually cause their body to essentially, I don't know, leach calcium or lose calcium or not absorb calcium?
Yes.
Okay.
And here's it. I mean, why do we have this epidemic? Well,
Right.
one reason is 100 years ago, people didn't live long enough to be osteoporotic.
Okay.
And they were physical. So we
Right.
have become, we used to make our livings on the farm, building things, hunter-gatherers. Now we make our livings in front of a computer screen.
Right.
Right.
And we don't go out and play ball. We go and play ball with the pros that we're just as good at on our video game.
Right.
So first, we're much more sedentary. So it's what you don't do. You don't exercise.
Right.
Secondly, we used to be out in the sun. So our vitamin D was naturally being converted to the active hormone. We are advised not to do it so we don't wrinkle and we don't get skin cancer. And our food was natural. I always tell my patients, and this is an homage to Johnny Cochran, if it's bottled, packaged, or canned, it should be banned.
I love it. So, all right, so you know what? You've got people sitting at home very skeptical. We are bombarded with information. We're looking at products. We've seen infomercials about other things. Why am I going to trust you?
It's a good question, and I wouldn't trust somebody else. That's why I went to medical school. I went to medical school in part because I, like so many of us, lacked faith in doctors. And for myself and my family, my loved ones, and now that extended family of my patients, I wanted to provide the best advice.
So you made a commitment, like I did, to find the truth, and I've been committed to finding that for a very long time. Is that what led you to create this product?
Correct. And in fact, the truth changes. So my purpose here is to provide the education, the understanding, and to basically get into people's head and say, God, do I want to eat rock or do I want to eat a green plant?
Dr. May, we're actually running out of time. It's been an amazing show. I'm sure we'll have you back. You know, folks, if you're watching and you're concerned with bone loss, if you want to improve your joint health and mobility, and you know, just basically take control of your health, then pick up the phone and give us a call. AquaCal is an all-natural breakthrough for those who are concerned with bone loss, bone health, osteoporosis, and it's only available exclusively through this special television offer.
Well, and the best of all, because we've worked out a special arrangement with Dr. Larry May, is that you're going to receive a substantial savings off the regular price of AquaCal so that you get to try it and see for yourself how valuable this product is. Plus, if you call in the next 2 minutes, you're going to see how simple it is to get your first month's supply of AquaCal absolutely free.
Folks, again, this product has been scientifically formulated by a Harvard-trained medical doctor who has spent the time, and you said it earlier, he really ultimately designed this for yourself and your family and your loved ones, again, which is really amazing. Folks, this product is one of the best sources of vitamins and minerals. It's unconditionally guaranteed to work, so pick up the phone and give us a call. My name is Michael Alden.
I'm Forbes Riley, and I want to thank you all so much for watching.
These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.